Hey guys, and welcome to my channel. Today we will discuss the microbiology paper 1 MCQs asked in the recently held MUHS second year theory exams. We'll try to make it quick but explain as much as possible. So moving to the first MCQ, this is pretty straightforward. The incubation period refers to the time duration. They had given this various options. You have to quickly go through the options and always look out for words such as except, all, or etc. in the question. Read it properly, don't make haste, but try to answer as quickly as possible. So obviously incubation period refers to the entry of the organism or the pathogen into the body and manifestation of the symptoms and the signs in the host. So not all infections lead to disease. Infections means merely the entry of the organism into the body, and the number of days which it takes for the first sign or the symptom to appear, that period is known as the incubation period. So generally speaking, it's very difficult to determine when that particular organism had entered that particular patient's body, but with many studies, the incubation period of common diseases have been found out, and then one can kind of retrospectively think that on what day the organism might have entered. Resolving power of the electron microscope is, they have given the various options. You have to see that this is nanometer and this is the micron or micrometer. So electron power microscope has a very good resolving power. Resolving power means the minimum distance at which two distinct points can be seen as two different entities. So obviously it has to be low for the electron microscope. So some electron microscopes do give resolving power of 1 nanometer, and the best ones give up to zero point 0.1 nanometer. That is the model answer for this particular question. So pretty straightforward. It's the lowest number which you see on this particular options, and that happens to be zero point 0.1 nanometer. So here you have to see that the word except, so you have to answer accordingly. That is, all of the following are enrichment media except. So they had the options of thioglycolate broth, Mueller-Hinton, selenite F, alkaline peptone water. So selenite F is used for type Phi and Shigella, and alkaline peptone water is used as an enrichment medium for Vibrio cholerae, and thioglycolate is used for the anaerobic organism. Mueller-Hinton is something which neither supports nor inhibits the growth of the organism, is and is mainly used for the antibiotic susceptibility testing. Mueller-Hinton broth, which is then used to dip the swab and then layer it on the Mueller-Hinton agar. So it is not an enrichment media. It is something media used specifically for antibiotic susceptibility testing. So 22-year-old man with acute onset nausea, vomiting. Chinese restaurant here is a very big clue. So it is a very straightforward answer. You can see that it's the last meal. So the incubation period is low. So obviously the person must have had the last meal just a few hours ago. So Staphylococcus aureus can also cause with a very low incubation period, but it is generally seen in pastries, etc. The answer here is obviously Bacillus cereus. So if you have a clue like Chinese fried rice or Chinese restaurant, then you can safely answer it as Bacillus cereus. The emetic form has a very short incubation period, as is the case in this particular question. So next question is, a slum dweller with fever and upper quadrant abdomen pain and dysentery. So you can see there are many clues: dysentery and a single cyst, that must be a liver abscess, and the stool is showing quadrinucleate cyst. So it's pretty straightforward. It has to be Entamoeba histolytica, which shows the quadrinucleate or 4 nucleus in the cyst. Again, a straightforward question: virus causing most common diarrhea in infants and children. It is viral diarrhea, and out of that, rotavirus is the majority of them are rotavirus. Obviously, that is why there is no need to give any antibiotics in most of the cases of diarrhea in under five children. So the answer is rotavirus. So again, here there are some clues in this question. 11-year-old casualty with bloody diarrhea, cramping, and fever. Anuric for past 12 years, confused pale, pedal enema, and hamburger. That is another one clue. So obviously it's a dysentery, not a diarrhea. ETX-EC gets excluded. ETX causes mainly diarrhea, not dysentery. You have to know that EHEC has been found in hamburger, the beef hamburger. So H for hamburger and EHEC. So the right answer is EHEC. This is the hemolytic uremic syndrome, which is seen with EHEC. So that is another MCQ which you can be asked. That is hemolytic uremic syndrome is most often associated with, and the answer is again enterohemorrhagic Escherichia coli or EHEC. So true regarding Malditov, many of you have not got this right. So you have a tendency to write Malditov everywhere. You should realize that Malditov is a kind of proteomics. It's not like a PCR test which can identify the DNA or RNA right from the specimen itself. Whereas Malditov, it actually requires the culture of the organism, and that to a pure culture, means a single bacteria to actually give a good result. Otherwise it will come up with something like a bad spectrum. It is follows the scattering of the laser, so you need a single particular organism to be there. That is why it cannot be done directly from the sample, which many of you have answered. In neither does it target the cell wall component. It's based on the proteins, and it is very specific identify a particular culture. So the answer here is requires culture of the organism. So it does take 1 or 2 days to for the Malditov to be actually done on the bacteria which grows from the specimen belonging to the patient. So never write Malditov in your lab diagnosis of viral diseases or malaria, etc., because these organisms are not generally routinely cultured for diagnosis. You can write Malditov for bacterial diseases like Staphylococcus aureus or E. coli, etc. But again, for a UG level, just writing generically Malditov doesn't make sense, to be very honest. But whenever you are writing, you should realize that it has to be mostly a bacteria or a yeast or a mold. So that only in those cases we can actually do a Malditov after it has grown in the medium. There is the case scenario is redundant. It's a clinical scenario of asthma and then type of hypersensitivity seen in asthma. So all these words make no sense if you just move to asthma, and obviously asthma is a type 1 hypersensitivity where you will see the breathlessness and wheezing, etc. So that is straightforward. Once again, CD8 T cells are recognized. CD8 T cells recognize antigen in association with. So the answer here is MHC1. Always remember MHC1 is CD8. So the lower number will be with the CD higher number, and MHC2 are associated with CD4. So MH2, if it is asked, then it will be CD4. MHC1, if it is asked, then it is CD8. So again, here you have to stress on the word the except. So they have asked all the following are true except true with regards to PCR except. So you have to find out the false statement. If you read the statements A, B, and D are actually true. PCRs are very sensitive. They can detect very few bacilli from the clinical specimens. Nested PCR have sequential 2 primers used, and multiplex PCR can in a single well target 2 or more sequences simultaneously. So the answer is actually RT-PCR can amplify double-stranded DNA but not RNA. So it can indeed amplify RNA. RNA is converted into the complementary DNA using reverse transcriptase enzyme and then amplified. So that is the answer. Who is a paradoxical carrier? Again, straightforward. A carrier who acquires a pathogen from another carrier is known as a paradoxical carrier. So these are frequently asked questions about the carriers. So you just need to see the definitions. Here also, many of you have not got this right. Narrow spectrum antibiotic means those the antibiotic which is not broad spectrum. So answer here is vancomycin, which is mainly for the gram positive cocci, and that too if as a last resort when other antibiotics are not going to work because bacteria is resistant to it. So tetracyclines, ampicillin, amikacin, all broad spectrum antibiotics. Ampicillin is a broad spectrum, but many a times it is resistant in most of the bacteria, so probably not that much in use these days. But yes, certainly these are all broad spectrum, whereas vancomycin has a very narrow spectrum, that is only the gram positive. There are very few GNBs or gram negative bacilli which can respond to vancomycin, but they are beyond the scope of undergraduate student, so to speak. So this is again another question which many of you have got wrong. Guidelines on antibiotics usage in hospital is known as. So I've tried to explain what these terms mean. So antibiotic stewardship is actually a program where it's a multidisciplinary thing where the clinicians, the microbiologists, the pharmacists, all of them work towards the right use of the antibiotic, and you know give it in the right dose for the right duration for the right indication, etc. So antibiotic policy is a part of antibiotic stewardship, where there is a written document based on the local antibiograms which tell you if certain infectious conditions come to you, what kind of antibiotic to start. Let's say, for example, are suspecting acute pyogenic meningitis, so what kind of antibiotic should I start with, or let's say tonsillitis, what kind of antibiotics I should start with before the culture report is available. So that is given by the antibiotic policy. So it's exactly a guideline on antibiotics usage. So the right answer here is antibiotic policy and not antibiotic stewardship. Antibiotic stewardship is a program of which antibiotic policy can be a part of. So ideally the antibiotic policy should be based on the local antibiogram. Antibiogram is the resistance pattern of the commonly isolated bacteria in that particular hospital or locality, like if you say Mumbai, etc., in that particular setting. So ideally we should have that data. If not, then we tend to rely on the national data or the international data, and does not quite correspond well with the Indian setting. So it's better to have a local antibiogram. And antibiotic audits are where to check the compliance to the policy or the rational antibiotic use by the clinicians by auditing their prescriptions, the indoor prescriptions or the outdoor prescriptions, and then you kind of check whether they are actually following the policy or not. So that is an antibiotic audit. So the guidelines, the answer would be antibiotic policy. X of Schistosoma mansoni again repeatedly asked questions. All this you should know. They ask even in the NEET PG exam. So there is no way to kind of remember except to see the various eggs, and this is how eggs of Schistosoma mansoni look. They are elliptical with a sharp lateral spine. Culture media not used for Shigella. You have to understand the answer here is telluride blood agar, which is mainly used for Corynebacterium diphtheriae, which is the causative organism of diphtheria. All the other three are media on which Shigella will grow selectively. McConkey is used as a selective medium for gram-negative bacilli, whereas DCA and XLD are more specific for Salmonella and Shigella, as they will inhibit the other gut bacteria. Father of antiseptic surgery, there is no way to kind of know without reading about it, and it happens to be a surgeon himself, that is Joseph Lister. He introduced the use of carbolic acid and the other antiseptics in the surgery. So you can see this particular man in the center with the beard is Joseph Lister. So he was a surgeon himself and is known as the father of antiseptic surgery. Subacute bacterial endocarditis most frequently caused by. So you have to understand that out of these options, the right answer would be Viridans streptococci, because these are less virulent organisms. They are generally present as commensals. That is why they take more time to cause the endocarditis. Hence, it is the subacute version. The more virulent organisms like Staphylococcus aureus and beta hemolytic streptococci will cause the acute endocarditis, whereas the less virulent viridans group of streptococci will cause the subacute endocarditis. Which of the following bacteria discovered by Robert Koch? So you should know that he is one of the greatest microbiologists there, and he had given the Koch's postulate, and he discovered the causative agents of TB, that is Mycobacterium tuberculosis, and the cholera, that is Vibrio cholerae, and Haemophilus aegyptis, and various other contributions to microbiology, and had a Nobel Prize for his work on tuberculosis in 1905. And you should also know the Koch's postulate, which is often asked in the theory exam and even in the viva. Last question is, during which phase bacteria are most susceptible to antibiotics? So you have to understand that antibiotics work the best, especially the bactericidal antibiotics. They work the best in actively multiplying cells, and as you know, the growth curve, the log phase is the one where the bacteria are actively multiplying. So you will have an initial lag phase, and then the bacteria goes in a log phase where it is logarithmically increasing in count. The bacteria are actively multiplying, and when you get a bacteriostatic drug is added, then this colony count will stay as it is. It will not increase. If there would have been no antibiotic, it will have keep on going on increasing till it reaches the plateau or the stationary phase. But if in the presence of bacteriostatic drug, the counts will not increase. But when you have a bactericidal drug, it will start killing the bacteria, and the counts will go start decreasing drastically. So that is why generally it is said bactericidal drugs are better. But nowadays the concept has changed a little, again beyond the scope of discussion for this particular platform. There are a lot of pharmacokinetics and pharmacodynamics involved, but you should understand that bactericidal drugs work best when the bacteria are actually multiplying, and that is in the log phase. This is one of the reasons why prophylactic antibiotics are not given for more than 1 or 2 days, because if you are the person is not currently having an infection, and so if you are giving antibiotics, what is it going to kill is the your good bacteria inside the body, because the pathogen has not yet established itself in the body, and you just want to prevent the future infection in a person who is having more risk of developing infection. So with respect to the answer to this question, it is obviously the log. Do give me feedback about this video. I'm going to post one on paper 2 as well, and if you want to have any kind of changes, or if you want some improvements, do let me know, and take care.